So this is a really good teaching tool for optometry and undergraduate medical students. They mostly struggle with the content in the sense that they've got all these principles about disease that they understand, and then they've got to apply them to how the eye works.
EyeSim was made in collaboration with the Faculty of Medicine at UNSW, specifically the School of Vision Science. We worked closely with ophthalmologists in the school.
So what part of the retina is that? That's where the image lands when you look at things.
The spot, or like the macula.
The macula is the central part.
The fovea.
And the fovea centralis is the little pit when you look at the anatomy.
I loved it. I think we don't usually get any sort of experience like this, right? And for us as well, we never get to see what patients see because we don't have visual problems. And a lot of us don't experience myopia or hyperopia or anything really. And so getting to actually see it, for myself through a VR set was really, really useful. And I think you can relate a lot more to people's struggles.
Lots of people with their eyes, if they work, you don't think about it, you take it for granted. The word blurry, for example, is a common way people will say something's not right with their vision, but it doesn't mean a great deal. Blurry because it's out of focus, or is there something else wrong with it? So it's born out of this notion that we need to come at the need to understand eye disease from a different perspective, thinking about what the symptoms are like for a patient to have this.
I've always thought that as a doctor, the biggest superpower you can have is experiencing what the patient feels to treat them and give them the best treatment possible. So I think this device was able to simulate it to the closest possible level.
What would it be like if I could see like this? How is it that the disease I'm reading about means that this happens to the eye? So it's just an exciting way to teach, to come at thinking about this in a totally different way to the usual way they're taught.